Individual, you would look at that and ask the person, do you have pain when you move that extremity? If there is that, then it would not be unacceptable to call the 911 to come and have the patient taken to the hospital for a check. If the person falls and gets up on their own, or can move to get up and does have some weight bearing, then it could be appropriate to wait. But again, I would also call the physician or call the nurse that's on call for the home health or call that office and tell them what had occurred and find out whether they would want you to go to the emergency room at that time. I would not want someone to be able to pick them up, put them back in bed, and then find out the next morning that that leg has been broken or it's been swollen and they didn't feel any problem at that time. Most of the time this happens, it happens with people that have memory loss, Alzheimer's type dementia. They do not respond to the pain, or if they do respond to pain, they still think I should get up and walk.
Before examining how to enhance the patient's mobility through a regular exercise program, there are some things you need to consider for patients with limited mobility.
When someone's taking care of someone at home, the individuals at home usually stay in bed, or they have basically a bed to chair type of existence. That becomes a problem for individuals because they become immobile. And when they do become immobile, muscles can contract. Complications that can occur from that, serious ones, would be, for example, someone can get a blood clot in the lung called a pulmonary embolus. Normally when we walk, the muscles contract. That helps blood get up into our heart, and it pumps out through the lungs and around to our body again. When you don't have that, the heart has to work a little extra harder to do that. So some of the things that you could do is to help what's called maintenance range of motion, and having a routine daily of some form of what I call bed exercises, just simple movement of the arms back and forth.
Routine exercise stimulates circulation and keeps the joints and muscles in working order. Exercise also improves a person's mood, appetite, ability to sleep, and general sense of well-being. Even small tasks can be beneficial. For example, brushing the teeth or hair promotes range of motion. It's important to encourage the bedridden or wheelchair-bound patient to perform as many independent movements and exercises as they can, but always under the guidance of your doctor or physical therapist. Most of us begin each day by dressing. Even if we're not feeling our best, getting dressed each day and making every attempt to look our best gives us a feeling of self-worth. That's why, if your patient is able to get out of bed and get dressed, it's important to give them every opportunity to let them do that. As a caregiver, you may have to help your loved one with this essential task. A daily routine of grooming and dressing will improve the person's self-concept and self-confidence, as well as create a more normal lifestyle for daily activities within the household. But before you begin the daily task of dressing and clothing selection, there are 4 principles to keep in mind. Principle number 1, determine what the person is capable of doing independently, then encourage your loved one to do as much for themselves as possible. Typically, if the person can make basic decisions and complete simple tasks, they can probably dress themselves too, or with a little bit of help. Principle number 2, learn to work around any obstacles to independent or assisted dressing. You may need to communicate a clear and firm expectation that the person will get dressed each day. If the person has dementia, you may need to lay out the clothing one piece at a time in the order they'll put it on. This will help avoid confusion, like putting on underwear over top of slacks or shirts. If required, provide simple instructions for dressing. People with physical limitations may need some hands-on assistance or adaptive devices to dress, such as a button fastener. Principle number 3, keep safety in mind when selecting clothing and accessories. Make sure clothing is flame resistant, especially if the patient smokes. To prevent falls, select shoes with rubber or crepe soles. Slip-on shoes should fit snugly enough to prevent the patient from stepping out of them as they walk. If the shoes are a lace-up style, be sure they're securely tied with laces short enough to prevent the possibility of tripping. Principle number 4, always try to keep the person's dignity in mind. Some patients are too confused or immobile to help with their own dressing and grooming. If this is the case, provide a private area for dressing. Explain to the patient each step of what you're going to do beforehand. Take extra care when maneuvering limbs in and out of sleeves and pant legs. If the patient is immobile or has paralysis, be sure to support the extremities to avoid muscle strain or stress to joints and bones. For example, while putting on slacks, support the knees and ankles against the trunk of your body, then reach into the pants leg and slowly pull the leg through while you securely support each leg one at a time. The same rules apply while putting a shirt on a person with a paralyzed arm. Reach into the shirt sleeve, then slowly pull the patient's arm through the sleeve while you carefully support the arm. Another important guideline: respect the person's selection of clothing as long as it's safe and seasonal. Most importantly, remember that dressing should be a positive experience, not a battle. So if patients tend to choose clothing that doesn't match or coordinate, occasionally indulge them. Compromise and praise are two rules of thumb. Be generous with both. Express to your loved one how attractive they look after dressing and comment positively about their cooperative manner. These simple steps will help your loved one have a better sense of connection and stay actively involved in an essential daily routine. Experienced caregivers know the home setting can be a help or a hazard when dealing with patients who have physical or mental challenges. In this section, we'll talk about the various challenges in the home environment and provide guidelines and suggestions about how you might make your home safer and a more friendly environment for the patient. To get started, observe your home with a fresh eye for obvious dangers. Beginning at floor level, remove any throw or area rugs on hardwood or linoleum floors. They're prime candidates for tripping a foot or catching the leg of a cane or walker and causing a serious fall. Ideally, all floor coverings accessible to the patient should be on non-slip surfaces. Avoid carpeting with long pile or busy patterns that may give the illusion of movement. On wooden staircases, attach a non-slip surface on the outer edge of each step. Any sliding glass doors in the home should be clearly marked with masking tape or with decorative decals. Along these same lines, make sure upstairs windows are secured to prevent falls. In the bathroom, walk-in showers with wide entries provide the greatest accessibility for patients with limited mobility. For safety purposes, glass shower doors should be replaced with a shower curtain. Adhesive safety strips or non-slip bath mats should be positioned in the bottom of the bathtub or shower floor. You may also want to purchase a waterproof bench or chair to place in the shower or tub so the patient can sit while bathing. Whether your home has a shower or a tub, it's advisable to install a grab bar on the far side of the wall along with a telescoping or handheld shower nozzle, which allows the patient to easily rinse while seated. Other bathroom safety measures include installing a grab bar by the toilet and lowering the temperature on your water heater to 110 degrees Fahrenheit. That's to prevent scalding patients who have limited skin sensitivity. Lighting is another area of concern for those who are visually impaired by age or health issues. If your patient is visually impaired, they will see your home differently than you do. That's because they often experience the loss of visual detail or reduced sensitivity to color and brightness. To help remedy these situations, avoid fixtures with bare bulbs or tubes which create hot spots. Also avoid can-type down lights, which concentrate pools of light. Also install blinds or other coverings over windows to block glaring sunlight. Because visually impaired people may have difficulty distinguishing colors of similar intensity, try to use simple patterns and colors with high contrast. Individuals with hearing impairments often have difficulty recognizing high-pitched sounds, such as bells, sirens, or smoke and fire alarms. It is also harder for these individuals to distinguish between voices and competing noise or background music. Therefore, try to reduce sources of background noise like multiple televisions, radios, appliances, or loud clocks. Many elderly and ill patients can't tolerate extreme temperature changes. As a general rule, patients prefer extra warmth in the winter and are less tolerant of extreme heat during the summer. One word of caution: avoid drafts of air near the patient. It's not only a source of discomfort, but can also lead to health complications affecting the respiratory system, bones, joints, or muscles. Limited physical mobility is commonplace with ill and elderly patients. However, it's extremely important to encourage independence to enhance your loved one's self-esteem and sense of pride. So consider simple home adaptations. For example, you can install handrails along the halls and the walls of the rooms the patient uses most frequently. The top of the handrails should be placed at 33 to 36 inches from floor level. There should be no more than 1.5 inches of space between the handrail and the wall to prevent the patient from getting an arm stuck between the wall and the rail. To make grasping easier, replace round doorknobs with pull levers. You may also want to remove any interior door locks that could make it easy for your patient to get locked inside a room. If your loved one is disoriented or visually impaired, you should also poison-proof your home. Lock up medicines and other toxic substances that the person might ingest either accidentally or on purpose. The same holds true for knives, razors, scissors, and other sharp instruments. Whatever special needs your loved one requires, feel free to discuss these with healthcare providers. They can make suggestions to help both you and your loved one feel more comfortable and confident in your home environment.